Welcome to the Let's Safe Toolkit for Home-Based Childcare webinar series, hosted by Childcare Web America, the National Association of Family Childcare, the Children's Environmental Network, Eco Healthy Childcare, and the National Center for Healthy Housing. I'm Kiami Harris from Childcare Web America, and we're really excited to be partnering with all these organizations to share information with you today about lead in soil and how you can take action to reduce the potential for exposure in your home-based childcare facility. And thank you for joining us. We recognize that free time is hard to come by and that these are especially challenging times to pay attention to anything other than keeping your families, children, and staff safe from COVID-19 or helping your business survive the global crisis. Regardless of whether you're joining us live this evening, watching the recording during nap time, or finding another opportunity to learn more about the dangers of lead, we appreciate your commitment to protecting children from lead exposure. This webinar is being recorded, and we will be sharing that at a later time in a few days or so. If you have questions, we won't be able to get to those tonight due to the time frame, but we will try to get those answered at a later time. During today's webinar, the third in a four-part series, we'll hear a little bit about the Lead Safe Toolkit for Home-Based Childcare, learn about the dangers of lead, review a sample policy that you can put in place to help reduce exposure to lead and soil in your home-based childcare facility, and share some tips on how to implement that policy effectively. If you listen to the first two webinars in the series, the next few slides will be a repeat of the information you heard, but hang in there for a few more minutes and we'll reinforce this important concept, and then we'll jump right into the focus of lead and soil. Today, we'll learn about steps you can take to reduce lead exposure in soil, but there are other ways that you and your children and staff in your facility can be exposed to lead. The other webinars in this series will help you address how to reduce exposure to lead in paint, in drinking water, and in consumer products like toys. All of the webinars in this series are being recorded and will be available online, and we encourage you to watch all four. The first two webinars about lead in paint and drinking water are already posted for you to view. For those of you watching live, our colleagues at the National Association for Family Childcare are pleased to offer training certificates for attending today's webinar. Proof of attendance will be sent via email within a week of this webinar. Please check your junk and spam email, as it often gets automatically sorted there. If you haven't received your certificate within 1 week, please email NAFCC at the email address shown at the end of today's webinar. To get us started, let me introduce Hester Paul from the Children's Environmental Health Network, who will tell you a little bit about the toolkit.
Great, Kiami, can you hear me all right?
Yes.
All right. Hi, everyone. My name is Hester Paul. I'm the National Director of our Eco Healthy Childcare program based out of Children's Environmental Health Network. This webinar series is based on a toolkit that was designed to provide home-based or family childcare providers like yourselves with resources and strategies to ensure the safety of your childcare facilities. It's available online at the link on your screen. Like the webinar series, the toolkit is divided into four main categories: how to avoid lead exposure from paint, drinking water, soil, and consumer products, plus a general resources section. Each of the four categories contains a sample policy that you can adapt for your business and share with the families you serve. We know that there's so much to keep up with on a daily basis when running a home-based childcare facility. To support home-based providers, we have created 4 lead-focused policies, which detail best practice commitments that can be added to your parent handbooks. Creating or adopting a policy ensures that a practice continues over time, regardless of whether you hire additional staff. All staff should be on the same page about how to prevent lead exposures. And additionally, the families you serve may be interested in knowing how you worked to prevent lead exposure within your home so they can follow suit within their own homes. You are welcome and encouraged to share these policies with the parents you serve so that they too can make similar changes within their own homes. Along with each policy is a worksheet to help you set the policy into action one step at a time. Each worksheet gives you valuable information about the importance of ensuring that homes are lead safe and provides approximate costs for the recommended steps to reduce lead exposures. These worksheets complement the policies. So for each of the 4 categories, avoiding lead exposure from paint, drinking water, soil, and consumer products, each will have both a unique policy and worksheet. The worksheets are longer documents, more comprehensive, and offer more detailed information about how to make changes within your home and feel confident that you can uphold your policy. Links to resources and contacts you can consult as you implement the policy are also provided. As we've mentioned, today we'll be focusing on steps you can take to reduce exposure from lead in soil specifically. We're going to cover a lot of information, and we've heard from childcare providers like you that it can be a little scary and overwhelming at times. So if you only take away one thing from this webinar, we hope it's that you know that help is available and that you can do this. We know you care, and that's the reason you're listening right now. And we've created this toolkit to make it a little easier for you to take action. You might not be able to do all of the things that are recommended right away, but that's why we broke up the toolkit into different areas so that you can find the right starting point for you and your childcare home. So let's dive in. Lead can be found in all parts of our environment, in the air, the soil, the water, and even inside our homes. Much of our exposure comes from human activities, including the use of fossil fuels and past use of leaded gasoline. Some types of industrial facilities, past use of lead-based paint in homes, and the past use of lead in the service lines that deliver drinking water to our homes. Lead has been used in a wide variety of products found in and around our homes, and in addition to paint, this includes ceramics, pipes, plumbing materials, solders, gasoline, batteries, ammunition, cosmetics, children's toys, and more. But let's step back just for a minute and remind ourselves of why it matters if children are exposed to lead and why your role as a child care provider is so important. Lead is particularly dangerous to children because their growing bodies absorb more lead than adults do, and their brains and nervous systems are more sensitive to the damaging effects of lead. It doesn't take very much lead to create harm. Imagine a standard sugar packet that you might use to sweeten a cup of tea or coffee. Now imagine that instead of sugar, it's filled with lead-contaminated dust. This packet is equivalent to about 1 gram of dust. Now imagine that 1 gram of dust spread evenly over the area of a football field. That's still enough for the EPA to consider it a contaminated surface. That means that the amount of lead-contaminated dust it takes to harm a child is invisible to the naked eye. That's important, so I'll stop to emphasize that point. Sometimes when we say dust, people imagine big dust bunnies or a thick layer of dust on a surface, but you might not even be able to see the amount of lead-contaminated dust that it takes to actually harm a child. So what happens when children are exposed? Very high doses of lead, which are rarely seen in the United States today, can cause seizures, coma, and death. However, even much lower levels, between 3 and 5 micrograms per deciliter, in a child's blood can lead to neurologic damage, including impaired memory and executive function, which is the ability to plan, remember instructions, and juggle multiple tasks. Such blood lead levels can lead to decreased IQ and academic performance, and can also actually cause behavioral problems such as impulsivity, hyperactivity, and attention deficit disorders. And it's important to note that even though lead is harmful in all these different ways, children who are exposed to these lower levels of lead won't actually appear sick. The only way to tell that a child has been exposed to lead is to have a blood test. The next obvious question is, if it's so dangerous, how do we get exposed to lead? And why are children at such a great risk? In addition to being more sensitive to lead's harmful effects, babies and young children can also be more highly exposed to lead because they often put their hands and other objects that have lead in them from dust or soil into their mouths. Infants with drinking formula also are in danger if the formula has been made with lead-contaminated water. People may be exposed to lead by eating food or drinking water containing lead, or from dishes or glasses that contain lead, inhaling dust that contains lead from lead-based paint or lead-contaminated soil, or from playing with toys with lead-based paint. A lot of lead exposure happens in and around home environments. We know that Americans spend up to 70% of their time on average in home environments, and that the number is even higher for certain populations, including the kids who spend time in your home, in your childcare facility. Think about the number of hours those kids spend playing in and around your home, and it becomes clear why it's so important to make that environment as safe as possible. Since the focus of tonight's webinar is on lead in soil, let's take a minute to learn a little about how that lead actually gets into soil. One of the ways that lead gets into soil is from lead paint that is flaked off or deteriorated from the side of a house or a window. The paint flakes, chips, or dust falls into the soil and contaminates it. Wind and water can also scatter the lead to other parts of your property. So this isn't just a problem for soil that's right next to your house. Lead paint was used on homes until it was banned in 1978. So if your home was built before 1978, this is one way that lead may have gotten into your soil. However, even if your home was built after 1978, you can still have lead in your soil. Some types of activities that put lead into the air, and they can travel through the air before settling into the soil. For instance, when leaded gasoline was used for cars, the exhaust put lead into the air so that homes are located near, let me start that one again. So for instance, when leaded gasoline was used for cars, the exhaust put lead into the air so homes that are located near busy highways or high traffic roads may have higher levels of lead in the soil. Leaded gas is still used to run small airplanes, so your soil may also be at lead risk if you live near an airport. And some types of manufacturing can put lead into the air. So if your childcare home is near a manufacturing facility, for example, that releases lead or was built on a previous industrial site, that lead can settle into the soil around your home also. Children may be exposed to lead-contaminated soil by playing in bare dirt. The main way children get lead into their bodies is ingestion. While some children eat dirt on purpose, this happens most commonly when children touch dirt, put their hands in their mouths, or when they handle toys that have been in the dirt and then put their hands in their mouths. It's also possible for children to consume lead by eating vegetables grown in lead-contaminated soil, such as carrots or sweet potatoes or other root vegetables. Lead in soil can also be tracked inside your house, so exposure can happen inside too. Remember that it doesn't take a lot of lead to harm a child, so even a small exposure can be a problem. The good news is that lead exposure is preventable. We know how to find sources of lead in your home and how to fix them. You can start taking steps today to protect all of those in your care. And the best news is that the steps you take today can have an impact immediately. And again, that's why we created the toolkit, to help childcare providers like you get started. As we already mentioned, the toolkit has a sample policy that you can adopt to help you protect those in your care from being exposed to lead in soil, and to help you communicate with the parents and staff about lead in soil and the preventative steps you're taking to address it. There is one version of the policy if your home was built before 1978, and one for if your childcare home was built after 1978. There are three major components to the lead in soil policy included in the toolkit. They're listed on your screen now, and they ask you to commit to 1, checking the condition of your home's exterior paint regularly for signs of chipping, cracking, or peeling. This only applies to homes built before 1978. 2, testing any bare soil on your property for lead contamination, or making sure to cover any bare soil with mulch, plantings, or grass. And 3, using best practices to reduce levels of lead-contaminated dust and dirt indoors. In addition to the general policy statement on lead in soil, the toolkit has a worksheet that contains 4 simple steps, each with step-by-step instructions on how to implement the lead in soil policy, which we'll go over in just a moment. We suggest that you review and fill out the worksheet once a year and keep it in your family handbook so that you and your staff and your clients can always have the most up-to-date information available. The first step outlined in the worksheet is to find out when your childcare home was built. This is because of what we discussed earlier about the use of lead paint in and on the outside of homes built before 1978. You can find out when your home was built by consulting the materials you receive at purchase. If you rent, you can ask your landlord. If your home was built after 1978, lead in exterior paint is not likely to be an issue, so you can go on to step 2. If your home was built after 1978, you should check for signs of chipping, peeling, or deteriorating paint once a week. If you do find signs of chipping, peeling, or deteriorating paint, you should clean up any visible paint chips from the ground immediately, consult the lead and paint worksheet for instructions on how to safely reduce exposure to lead and paint. It might be tempting to try to take the deteriorating paint off yourself, but if you don't follow lead-safe work practices, you can actually make the problem worse. The worksheet and webinar about lead and paint can point you to the resources to help. And you'll also want to follow step 2 through 4 in this worksheet to make sure that you are reducing exposure to lead that is already in your soil. Even if you've cleaned up the visible paint chips, if there is lead-based paint, there is likely to be a lot of lead in your soil that you actually can't see. Cleaning up the chips reduces some of the risk, but it doesn't eliminate it, so you'll want to follow the rest of the steps in the worksheet to protect the children within your care. Since lead-based paint isn't the only way that lead gets into soil, the next step is to test your soil, regardless of when your home was built or the condition of the paint on the outside of your home. You should test areas of bare soil around your childcare home. Testing should be performed by an EPA-recognized laboratory. You can find one of those by visiting the link shown on the screen. The link is also in the worksheet. Tests typically cost between $20 and $100, and you should contact the lab for instructions on how to collect the samples. They may actually supply sampling materials and forms, or they may come to your family childcare home to collect them samples themselves. Your state and local childcare poisoning prevention program may also be able to provide guidance on how to test your soil. So once you've done the initial test, you should check for and test any new areas of bare soil on an annual basis. Of course, if something changes, like you notice new areas of peeling paint on the exterior of your pre-1978 house, you may need to retest all of your bare soil. When you get the test results, share this information with parents and staff. If the test results indicate that you have a problem with lead in your soil, the rest of the policy worksheet will help guide you through the steps to take next. If you don't have a problem, you should still share the results and go on to step 4. If testing finds that you might have a problem with lead in your soil, that is, concentrations of lead above 400 parts per million in play areas of bare soil, or above 1,200 parts per million in other parts of the yard, you should take one or more of the following steps to reduce exposure. You can limit exposure to bare soil by planting grass, laying sod, or covering the soil with mulch or wood chips. This doesn't get rid of the lead or prevent exposure completely, but it's a way to help reduce exposures while you're planning for long-term action. You can also restrict outdoor activities by providing children a sandbox or water table as an alternative sensory activity space. Note that you have an outdoor sandbox, you should make sure to keep it covered overnight or when not in use. You can also create barriers, like a fence, between outdoor play areas and possible lead-contaminated areas so that children can't access those areas with lead-contaminated soil. To eliminate the contamination permanently, you can have the lead-contaminated soil removed and replaced with new soil that isn't contaminated with lead. This is likely the most expensive option, but it also provides the most protection. Costs will vary depending on how much soil needs to be replaced and whether there are any other complicating factors, like buried utility lines that a contractor would need to work around. You can find a certified lead abatement contractor by using EPA's locator tool shown on the screen and in the worksheet. And remember to keep all the records on file of the steps that you're taking to reduce exposure to lead in soil on your property. Step 4 will help you reduce the amount of dust and soil brought into your child care home. Everyone should follow these best practices in this step, even if lead in soil is not a problem. First, you should have a commercial walk-off mat that's as wide as your door at all entrances, or another option is just to go shoe-free inside your home. This will help reduce the amount of soil or dust that's tracked to inside spaces. You should also enforce a clean hands policy, especially in light of COVID, so that children always wash their hands with plain soap and water after playing outside. You can also help control dust and soil levels inside by cleaning in a specific way. This includes vacuuming often, using a vacuum with a high efficiency particulate air filter, so a HEPA or HEPA filter. Regular vacuums will put dust back into the air. You can wet mop floors daily. Dry sweeping can also put dust into the air, so wet mopping is much more effective at controlling dust and soil levels inside. And you can clean window frames, windowsills, and toys weekly. Use a damp mop, sponge, or paper towel with warm water and a general all-purpose cleaner. Whenever possible, use a cleaner that is certified as least toxic and fragrance-free, because we also want to reduce children's exposure to chemicals in cleaning products. The worksheet contains some guidance on what to look for when you're purchasing cleaning products. So hopefully you can see that lead in soil is a problem, but we can fix it. And there are small, low-cost steps that you can take to start protecting children in your care today. To help us learn more about the type of impact these small steps can make, let me introduce Dr. Alexander Wooten. Dr. Wooten is an assistant professor of environmental health sciences in the School of Community Health and Policy at Morgan State University. He focuses on urban soil pollution and remediation. Dr. Wooten is going to share some of his own research on one low-cost way to reduce lead in soil and protect the cares within your home. I'll pass it on to you, Dr. Wooten.
Thank you. Thank you so much. I must say, I congratulate my colleagues on the excellent way you contextualize the issue and the methodology with which you develop to have people who don't necessarily have a high science background and so forth, what they can do to alleviate the problem and prevent exposure. So you did a very good job. And so in keeping with that approach, the basis of my research is to address this particular problem, lead, contaminated soils, along with other heavy metals and the whole family of different heavy metals, but lead in particular, because it's so pervasive and it impacts a lot of people who live in urban and highly urbanized environments. So this is the basis of my research. And so about 2 years ago, we did a study, a short pilot study, to use some very inexpensive, cheap, and even free materials that can reduce exposure, even to very high bulk samples of lead. So I'll give you some details about what that research was about and the conclusions or the results that we achieved. The next slide, please. Yeah, so the two major objectives of this research was to do two things. As an environmental scientist, we want to reduce the amount of waste and, if possible, turn that waste into a valuable resource. So we know that there's a lot of leaf litter or organic matter in the form of leaf litter. And in the scientific literature, we kind of understand that there are certain properties, certain functional units that are part and parcel of organic matter that have the potential of sequestering or locking up lead in soils to render that lead non-toxic without necessarily reducing the overall total amount of lead. All right, so these are the two primary objectives that we wanted to achieve in this research. Okay, so we'll go on to the next slide. All right, so here we are, myself and a student intern of mine when we initiated this study. But one of the things I want to point out is that where we initiated the study and collected highly toxic soils in a residential neighborhood is that where you see in the background these townhomes in the center city of Baltimore, open fields, not necessarily sectioned off from people who live in that neighborhood. In the foreground, extreme foreground before me there were children in the field playing and, you know, doing what children do, wrestling and running around and so forth, having a good time. But the problem is it was in a field that had very, very high soil lead levels. And so that's what I'd like you to get out of that, out of this this image here, is that this was not a isolated environment. This was a very heavily populated section of the city. Next slide. Okay, so here is another summer intern in this area where we took readings and we saw these very high lead levels, collecting and taking bulk samples of lead so that we could later on set up an incubation study in the laboratory and test our byproducts that we have collected also from the field. So next slide. Okay, so now here is the treatment. Lead compost, right? We collected on Morgan's campus in a wooded area where the ground crew regularly dump large amounts of leaves that they have cleaned off of the campus year by year, and they break down and so forth. Well, we as you can see in that picture, we kind of scraped off the top levels to brush down further and further until we saw this darkened, blackened area where it's indicated that the lead, I mean, these leaves have been aged and composted, and so are in a condition for us to use. Next slide. Okay, so there's a lot going on here. This is the experimental design. What I want you to pay attention to is the levels at which the readings of the lead that we collected from the field in a very heavily populated residential area. Well, it's over 1,500 parts per million. And to put that in context, natural ambient lead levels range between 35 to 70 parts per million, you see. So this is problematic, particularly where children play, where there are people who live, there are barren, bare sections of soil that are swept up in wind and so forth. So this is a problem. And similar to what one of my colleagues said, in the United States, the permissible, and I put that in very strong quotation marks, the permissible level lead limits are 400 parts per billion, but that's still too high. The World Health Organization of the United Nations permissible bare soil lead levels are 100 parts per billion, and that is seen as the gold standard in my area. Those of us that study soil pollution and remediation and so forth, because it's much more closer to so-called natural levels. Okay, so that's what I'd like you to glean from this particular slide. Next, please. Okay, now it's one thing I want you to remember about lead. There is lead and there's lead and there's lead, okay? And we want to detoxify the lead, meaning that portion of lead that has the potential to be taken up into the bloodstream. You get a reading of say over 1,500 parts per billion. All of that lead is not necessarily going to be bioassimilated into the bloodstream to do pernicious damage to your nervous system. Some of that, due to its bonding and due to its mineralogy, will pass right through the digestive system. However, that portion of the lead that is bioaccessible, and like my colleagues have said repeatedly, it doesn't take much to do some very serious damage to the nervous system, particularly of a growing child. So therein is why this image is very important. The higher the total number, the greater the chances that there is a lot of bioaccessible lead. At the same time, I want to say that no level of lead found in soil is a good thing. Okay, therein is why your levels of lead in your soil, if you have children at play, or you're going to engage in some urban gardening and so forth, you don't want to your plants to take up lead to distribute it in those sections of plants that are edible. You need to have total and bioaccessible lead levels determined, okay? And it's not necessarily a very expensive undertaking, okay? Next slide. All right, so this is what we found. And these are promising results, okay? The first control is what the bioaccessible amount of lead was, and the low rate treatment, which is about 10% of leaf compost mixed into the contaminated leaded soil by dry weight, reduced the amount of bioaccessible lead by just under 29%. At the high rate treatment, still further a reduction of bioaccessible lead in that contaminated soil by just under 38%. So, you know, the results are very promising. Of course, our target is we want to get those numbers down as close to or below 100 parts per billion as possible, because that is the gold standard established by the World Health Organization. So we're very encouraged by this, and this gives us fodder for continued research in this area with that a byproduct and other types of very cheap, very inexpensive byproducts that anybody can use to reduce their exposure to this very omnipresent contaminant. And I'll hand it over to my colleagues.
Thank you, Dr. Wooten. We know we've covered a lot of ground tonight, but thankfully all the information we shared is included in the Lead Safe Toolkit, which you can download for free. The toolkit also contains links to several resources mentioned throughout tonight's webinar, where you get more information about how to safely identify and address lead soils hazards as you walk through the 4 simple steps we've outlined. I want you to remember that lead poison is preventable. We know how to find hazards and how to fix them, and help is available. And of course, if you have questions, you're welcome to contact the folks at Children's Environmental Health Network, and they'll do their best to give you the answers you need so you can take the first steps towards reducing lead exposure in your home-based child care facility. If you have already entered questions into the chat during tonight's webinar, we'll follow up with you over the course of the next few weeks. We'll also remind you that training certificates are available. Proof of attendance will be sent via email within a week of the live webinar. Please make sure you check your junk or spam email, because sometimes emails get sorted there. And if you haven't received your certificate within 1 week, please email NAFCC at accreditation@nafcc.org. If your state's agency accepts the training, you can submit your training certificate to your state's professional development registry. If you are working towards NAFCC accreditation, You may include this training along with your NAFCC accreditation application or NAFCC update. So please contact NAFCC for more information about training hour requirements. Thank you for joining tonight's webinar. We hope that you'll join us for the next webinar in the series on Tuesday, August 4th, which will focus on lead and consumer products such as toys. Today's webinar and all the webinars in this series will be available to watch as recordings at the link on the next screen. Thank you very much.